What's going on in Mexico has fallen off of many people's radar simply because there's so many other events going on in the world. The International Medical Corps has been here with a 4 to 5 person assessment team for the past week. We started in Mexico City and saw the work that was going on there for search and rescue. We also had meetings with Cadena, which is a nonprofit based here in Mexico City, and we have met with the Ministry of Health. We also went south to the more impacted areas in Oaxaca. What we have found is that in Mexico City, most things tend to be under control. Going south, there are estimated to be about 15,000 people that are homeless, whose houses have been destroyed, and they're living either with family, or most of them are actually living out in the streets, out in front of their own homes. With so many homeless people, there is always a concern about the impact on their health. We always worry about communicable diseases. The Ministry of Health in particular said, of course, they're concerned about cholera, Zika, and chikungunya, which are viruses that are spread by insects. The immediate needs that we see include the need for shelters for those that are homeless, the need for psychosocial support. There's always a need for what we call wash, water, sanitation, and hygiene. Many of these people don't have access to clean drinking water. They need food supplies. They need non-food items, hygiene packs, dish sets, cookware, those kinds of things. The capacity for the local government to handle the needs is fairly decent in general. I think that's certainly the case in Mexico City. Further in the south, things get a little bit more complex because there are populations that are very difficult to access, and there are fewer national support services, both for health and for recovery. There's still tremendous impacts going on in Mexico and tremendous recovery work that has to happen for those people that aren't yet back on their feet as a result of the earthquake in Mexico.